The guys, you've probably been there before, enjoying a romantic evening with your significant other, and when it's time to hit the stage and get intimate, your erection suddenly gets stage fright. You want to have a little fun, but you're struggling to perform. Well, don't worry, it's not just your problem, it's a common guy occurrence. Now, the good news is that not getting an erection every so often is completely normal. Almost all men experience temporary impotence about 20% of the time. Having erection trouble from time to time is nothing to be troubled about. However, when it becomes a regular occurrence, this is when you should take note that you may be suffering from erectile dysfunction. If you're really concerned, before you freak out, always consult a trusted doctor to help guide you. So, what is erectile dysfunction, or ED? In the simplest terms, it's the inability to get and keep an erection firm during sex. And it's widespread. Half of men between the ages of 40 to 70 have erectile dysfunction. And it's not just middle-aged and older guys. As many as 26% of men under 40 deal with ED. And some of the causes have been linked to medications. Now, we'll dive more into that later in this 5-part series, but first, let's explore what happens during an erection and why does dysfunction happen. The process of getting an erection is pretty complex and involves hormones, blood, nerves, and your brain. When a man sees, touches, smells, hears, or thinks about something arousing, the brain sends chemical messages to the blood vessels throughout the penis. There are 2 chambers full of tissue, blood vessels, and open pockets that run the length of the penis, called the corpora cavernosa. When the brain tells it to, blood fills the area, pressure traps it, and then the penis expands. This is an erection. Once the blood flow stops, usually after ejaculation, everything relaxes. When a man has ED, there's a good chance that something along the chain of events is causing an issue. In some men, ED can be a sign of an underlying health problem. The hardest part about dealing with ED is that it can be embarrassing to talk to your doctor. But there's nothing to be ashamed of. The condition is treatable. The key is identifying the root cause. So, how do you know if you have erectile dysfunction? The symptoms of ED are pretty straightforward. A man may be unable to get an erection at all, or maybe he only gets one sometimes. Some men can get an erection usually, but have trouble keeping it long enough for sex. Another symptom is just the lack of desire to have sex. Again, sporadically experiencing any of these symptoms is normal a lot of times. However, if one or more of these things are a regular occurrence and are affecting the enjoyment of sex, that's when you may have ED. You might think that ED isn't that big of a deal simply because it's something that happens behind closed doors. Now, over time, it can have an effect on different aspects of your life. It's evident when a man can't perform, his sex life isn't great. This can affect not only himself, but also his partner, and then eventually lead to relationship problems. For those couples who are trying to have a baby, erectile dysfunction could mean you having trouble getting your partner pregnant. Understandably, this can be annoying, cause a slight feeling of embarrassment, or fester with your self-esteem. But more importantly, it can trigger stress and anxiety, which could lead to other health concerns. Now, what causes erectile dysfunction? So, now you know what ED is and the symptoms. Let's explore 3 possible causes. Number 1, physical conditions. Turns out that a lot of stuff can be attributed to physical dysfunction. For example, inadequate blood flow can be the issue. Because blood is such an important part of getting and keeping an erection, any conditions that weaken the flow can cause impotence. These include heart disease, high blood pressure, hardened arteries, high cholesterol, and diabetes. Another cause of ED is when the nerves aren't getting the signals they need to make things happen. If there's damage or injury that blocks nerves in the lower spine, this can lead to ED. Other conditions that may trigger erectile dysfunction include obesity, metabolic syndrome, Parkinson's disease, multiple sclerosis, sleep disorders, and more. Many of these conditions can be pretty serious, so it's just another reason to talk to your doctor. Number 2, mental condition. Your mental health can also affect your ability to get an erection. Depression, anxiety, and relationship problems are common causes of ED. People with depression have a 39% higher chance of developing erectile dysfunction. Mental health is as important as your physical health, so make sure you address those issues. Number 3, smoking and substance use. Smoking, excessive alcohol use, and substance use can cause ED. These factors are within your control, so changing your habits can reverse the condition. Now, if you feel like you need help to stop smoking or treat an addiction, that's another thing you can address with your doctor, along with other possible causes and factors. So, now that you know the basics behind erectile dysfunction, you probably have a lot more questions about treatments and other potential causes. Don't worry, we'll explore more. Coming up in part 2 of our series on ED, we'll learn about what medications can contribute to erectile dysfunction. Now, if you've enjoyed this video, MedShadow has others to help, and liking this video will help us continue make more. To learn more about ED symptoms, other conditions, and medication side effects, visit us at medshadow.org and stay locked in for the next part of this series.